Okay, can everyone see my screen? Yeah, great. Thanks, Jane. Okay, thank you again for joining me. I'm really pleased to have you here for the webinar Nutrition During and After Cancer Treatment, What the Evidence Says. I'm going to leave some time for questions at the end, but feel free to use the chat if you want to just drop some questions as we go, and then I'll get to them at the end of the webinar. So, whether you've recently been diagnosed with cancer or you're currently undergoing treatment, you've finished treatment, or maybe you're supporting a loved one, or maybe you're just interested in learning some more about the topic, I hope that you'll leave tonight feeling a bit more informed, and confident about nutrition and cancer. And one thing I've learned as a clinical nutritionist is that nutrition is one of the topics where people feel most confused. But I guess it's like overnight, you're exposed to advice from family, friends, social media, books, podcasts, websites, AI, all claiming to have the best anti-cancer diet. But unfortunately, a lot of that information is conflicting, and some of it can be misleading, and sometimes it can be actually quite harmful. So tonight, my goal is to separate fact from fiction by looking at what the best available evidence actually tells us right now. And I'll try and get through the content as quickly as I can so we have time for questions at the end. So let's go. Thought I'd start. For those who haven't met me before, I'm Lisa Hanlon. I'm a clinical nutritionist with a special interest in integrative oncology. Um, and I've completed postgrad study in integrative oncology as well as sports nutrition and pathology diagnostics, another couple of areas of passion of mine. I've recently submitted my Master of Research thesis in late June, which was titled What are the Models of Care Necessary to Manage and Prevent Weight Gain in Breast Cancer Survivors in Australia? So hopefully, well, that's under examination at the moment, so hopefully I won't have to wait too long to get the results from that. And I'm also a wife and a mum. Sorry, someone's dropped into the waiting room. Okay, so why I chose integrative oncology. So I chose this space due to my sister Kim's melanoma journey, in that we found that communication between practitioners was non-existent, and there was a lot of information for Kim and for us as her carers to process and keep on top of. So for anyone who isn't sure what integrative oncology means, it's the combination of the very best conventional cancer care with supportive therapies that have valid scientific evidence behind them. So that can include nutrition, but it can also include exercise, psychological support, sleep, symptom management, and selected complementary therapies that have evidence showing that they're safe and beneficial, such as acupuncture. And importantly, these approaches are designed to support but not replace conventional treatments. And I really love working in this area because nutrition is something that people can actively engage with during a time where so much feels outside their control. Food can really support the body through treatment, maintain strength and muscle, and improve quality of life, and assist with recovery afterwards. So tonight I'll tackle some of the most common questions I hear in clinical practice. And these are the topics that I'm planning on covering tonight. It's a lot to get through. I think I might have to do a part two because there's just so much to cover in this topic. So basically, nutrition is not one size fits all. Trying to address the common nutrition myths, looking at organic foods, anti-inflammatory eating, ketogenic diets and fasting, what matters, what really matters during treatment, supplements and safety, transitioning into recovery and survivorship, and then getting the right help. And before I begin, I'd just like to mention that this webinar provides general education based on current evidence that's available. It's not intended to replace individual medical or nutrition advice that you receive from your care team. If you're currently receiving cancer treatment and any significant dietary changes or supplements are made, like they really need to be discussed with your treating team, who understands your individual circumstances. Okay, so nutrition is not a one size fits all, and you're going to hear me say that quite a lot tonight. There's a growing body of high quality evidence supporting nutrition as an essential part of cancer care. And while nutrition can't treat or cure cancer, it plays a really important role in managing treatment-related side effects, improving overall nutrition status, preserving muscle mass, supporting treatment tolerance, reducing cancer recurrence risk, and improving overall quality of life. We also have we have strong evidence that healthy dietary patterns, particularly the Mediterranean diet, are associated with the lower risk of developing several cancers and may improve long-term health outcomes after a cancer diagnosis. But during active treatment, nutrition goals usually differ from those used for cancer prevention. Cancer Australia recommends a varied, balanced diet, but acknowledges that treatment can significantly alter appetite, taste, digestion, and the ability to eat, which leads to one of the most important messages from this webinar. The healthiest diet on paper is not healthy for an individual who can't eat enough of it. During treatment, the priority is often to ensure adequate energy and protein intake, even if that means temporarily modifying what someone would usually consider to be a healthy diet. And this can be a bit hard for some people to wrap their head around. Yeah, it was mind-blowing for me. Early individualized nutrition intervention is particularly important for people who are experiencing weight loss, reduced appetite, any gastrointestinal cancers, head and neck cancers, major surgery, or treatment-related symptoms that limit food intake. Reviews demonstrate that early individualized nutrition support can help preserve nutritional status, reduce the risk of malnutrition, improve treatment tolerance, and support quality of life. So this is why there's no single anti-cancer diet. The right nutrition advice depends on where you are in your cancer journey, what treatment you're receiving, the symptoms, and your individual goals. Unfortunately, nutrition is also one of the areas where people receive the most conflicting advice. Social media, well-meaning friends and family, and the internet often promote restrictive diets or miracle foods that simply aren't supported by good enough evidence. And I know what it's like, of course, being a carer for someone with cancer, you just wanting to find the one thing that will turn everything around. So the next slide, I'll look at what the evidence actually says about some of these common myths. Okay, so the first one is XYZ food cures cancer. I've heard quite a few of these in clinic. And one of the biggest myths is that a single food can cure cancer. So it might be turmeric, broccoli sprouts, mushrooms, celery juice, or the latest, pardon me, superfood trending on social media. But the reality is that there's no individual food that's been shown to cure cancer yet. That's not to say these foods aren't healthy. They absolutely can and should be part of a nutritious diet, but we need to be careful about attributing therapeutic effects that just aren't supported by human clinical trial evidence yet. So cancer is incredibly complex, and nutrition works through overall dietary patterns, nutritional adequacy, and supporting the body through treatment, not through one specific superfood. The second myth is natural equals safe. So unfortunately, that isn't true either. Many natural products have biological effects. Some herbs and supplements interfere with chemotherapy, immunotherapy, radiation. They increase bleeding risk before surgery or affect how medications are metabolized. So this is why it's really important that you tell your treating team about any supplements, any herbal products that you're taking. The third one is people with breast cancer should avoid soy products. And this is probably one of the most persistent myths I hear in clinic, and it might blow your mind just like it did mine. For many years, people believe that because soy contains compounds called isoflavones, which are sometimes referred to as phytoestrogens, they should be avoided after breast cancer. But this is an area where the evidence has changed a lot in the last 10 years. Large human studies now show that eating normal amounts of soy foods is safe, even for women with hormone receptor positive breast cancer. Several large cohort studies have instead associated higher soy food intake with lower recurrence and, in some analyses, lower mortality. A pooled analysis of more than 9,500 survivors back in 2012 found that consuming at least 10 milligrams of soy isoflavones per day was associated with about a 25% lower risk of recurrence, with no evidence that soy reduced the effectiveness of tamoxifen. A systematic review in 2013 likewise found no evidence of harm from normal soy food consumption and concluded that traditional dietary amounts appear safe for breast cancer survivors. Around 1 to 2 servings per day of soy products such as soy milk, tofu, tempeh, edamame can comfortably fit within a healthy dietary pattern. Soy is also a really useful source of high quality protein, which can be really helpful during treatment and recovery. The next myth is, should you stop eating sugar because it feeds cancer? And the short answer is no. So the myth comes from a scientific observation that is actually true, but it's been taken a little bit out of context. Cancer cells do use glucose or sugar for energy, but so do healthy cells throughout your whole body, including your brain, your muscles, and your red blood cells. The important point is that every cell in your body needs glucose to function. And even if you completely avoid sugar and carbohydrates, your body still needs glucose, so it makes its own through normal processes. It can produce glucose from protein and fats that you eat to keep your blood sugar within a narrow range. So unfortunately, you can't selectively starve cancer by eliminating sugar and carbs from your diet. But what can happen is people can become afraid of eating and they start to cut out fruit, dairy, grains, and other foods that are quite nutritious and end up eating a very limited diet. So that can lead to weight loss, muscle loss, fatigue, poor nutritional status overall, all of which can make treatment more difficult. So instead of focusing on eliminating sugar, I encourage people to focus on the overall quality of their diet, which means enjoying plenty of vegetables, fruit, whole grains, legumes, and quality sources of protein, while also limiting foods and drinks that are high in added sugars as part of an overall healthy eating pattern. It's also important to remember that during treatment, if someone's struggling to eat because of nausea, mouth ulcers, poor appetite, getting enough calories is way more important than worrying about a small amount of sugar at that time. So sometimes that ice cream, the custard, or a milkshake might be exactly what someone needs to maintain their nutritional intake. And the Cancer Council of Australia explicitly describes the claim that cutting out sugar and carbs will stop cancer growth as a myth and warns that it might be harmful. So it's sensible to limit drinks and foods high in added sugar. I think that that's the case for everybody, particularly after treatment or when managing comorbidities such as diabetes, cardiovascular disease, or excess weight. And the cells that we most want to protect during treatment, which are your immune cells, your gut cells, your muscle cells, also rely on adequate nutrition. So restricting food doesn't just affect the cancer cells, it affects your healthy ones as well. So that leads me to my next myth about losing weight during treatment. And this is something that I investigated quite a bit in my thesis. Many people assume that everyone with cancer loses weight during treatment, but the reality is actually more complex. Some people do experience significant weight loss because of reduced appetite and nausea and things that I've mentioned previously. Others maintain their weight, but many people actually gain weight, particularly breast cancer survivors, during treatments such as hormone therapy, corticosteroids, and because of changes in their gut microbiota or fatigue and reduced physical activity. So instead of expecting weight loss, we should be monitoring changes in nutritional status. And one of the biggest concerns isn't just losing weight, it's losing muscle. So looking at the scales isn't necessarily a representation of where your weight's at. You can still stay the same weight, but lose muscle mass. And muscle plays a crucial role in strength, mobility, immune function, recovery from surgery and treatment. And it even helps with treatment tolerance. So that's why we place a strong emphasis on consuming enough protein and enough total energy through treatment. So mostly for people, maintaining weight is their goal. For some, it's preventing further weight loss. And for others who might begin treatment carrying a little bit of excess weight, intentional weight loss, it's not usually recommended during active treatment because that's the sort of thing that you can sort of think about once treatment's finished. Nutrition goals really need to be individualized in this case. So yeah, so they're the biggest myths that I hear in clinic. You might have some others for me to ask along the way, but they're the main ones. So now I think we might look at some of the most common dietary questions I hear. So the first one is, do you only need to eat organic? And the short answer is that organic foods can be a part of a healthy diet, but they're not a requirement for good nutrition or for cancer risk reduction. So at the moment, there isn't any strong evidence to show that eating an organic diet improves cancer treatment outcomes or reduces the risk of cancer recurrence. So if buying organic aligns with like your personal values or it fits comfortably within your budget, then it's a great choice. But I don't want anyone to feel like they have to buy organic in order to eat well. And while I'm personally concerned about pesticide residues, one of the biggest concerns I see is that people become so worried about them that they start to avoid fruits and vegetables altogether because they can't afford organic produce. So instead of letting that happen, you might have heard of the Dirty Dozen and the Clean 15 lists. Um, if you haven't, they're updated every year by the Environmental Working Group in America. And they rank produce according to the amount of pesticide residue detected after routine washing of produce. So if buying some organic produce is important to you, but you have a limited budget, then these lists can really help you prioritize where you might choose to spend a little bit of extra money. But they're not a list of foods to avoid. It's really just a budgeting guide for people who prefer to choose some organic produce. And whether your fruit and vegetables are organic or conventionally grown, good food hygiene is still important. It's really important to remember to wash produce thoroughly in a sink of water with a cup of vinegar and then rinsing it off. The vinegar just helps to remove some of the surface contaminants. And for firmer fruits and vegetables, you can gently scrub them, scrub the surface, and that can help remove any other additional residues. Just thinking things like apples and carrots, things like that. I'd also like to take this opportunity to remind you that fresh isn't always the most nutritious option. Frozen vegetables and fruit are really great options. They're picked at peak ripeness, which helps to preserve their nutritional value, and they're really convenient too. So the most important message is don't let cost or fear stop you from eating plenty of fruits and vegetables. Whether they're fresh or frozen, organic or conventionally grown, they all contribute to a healthy dietary pattern. And if you have a farmer's market nearby, it's a really great way to buy produce that's fresh and in season. I really encourage you to try and choose a different fruit or vegetable each week, even if you're not sure how to cook it. I've grabbed things like celeriac from the market and just asked Google or ChatGPT what I might be able to use it for, and it's been quite good. I actually quite like celeriac now. So it's on a regular rotation when it's in season. So it's a good way to try something new. Oops, sorry, I've just gone one too far. Okay, so one diet that is becoming increasingly popular over the last few years is the anti-inflammatory diet. You'll see a lot of books, social media posts, and supplement companies claiming that certain foods can dramatically reduce inflammation. But inflammation is actually an essential part of the body's immune response, and often it's the purpose of treatment. So we need inflammation for healing and fighting infections and repairing damaged tissue. But the problem isn't the inflammation itself, it's really the chronic low-grade inflammation that we want to target, which has been linked to a range of chronic diseases, including heart disease, type 2 diabetes, and some cancers. So researchers have found that overall dietary patterns can influence markers of inflammation. And when we look at the dietary pattern with the strongest evidence, it consistently resembles the Mediterranean diet. And the Mediterranean diet isn't restrictive, it's not a short-term eating plan. It's really just characterized by eating mostly vegetables and fruit, legumes, whole grains, nuts and seeds, fish and other appropriate protein foods like poultry and lean meats, unsaturated fats, moderate dairy, and herbs and spices. And it limits highly processed foods and meats, sugar sweetened drinks and foods, highly refined discretionary foods, and alcohol. So it's a pattern of eating built around mostly whole, minimally processed foods. And there's compelling evidence that following a Mediterranean style dietary pattern is associated with a lower risk of developing several cancers, better heart health, lower risk of type 2 diabetes, and reduced overall mortality. So, for cancer survivors, it also supports many of the same lifestyle recommendations promoted by organisations such as Cancer Australia and the World Cancer Research Fund for long-term health. Most of the strongest evidence for the Mediterranean diet relates to preventing chronic disease and supporting long-term health rather than treating cancer itself, though. But during active treatment, nutrition priorities often change, like I mentioned before. So, someone experiencing severe nausea, diarrhea, mouth ulcers, swallowing difficulties, significant weight loss just might not be able to follow a traditional Mediterranean eating pattern. And in those situations, priorities shift to make sure that they're eating enough energy and protein, even if that means choosing softer foods, lower fiber foods, or foods that wouldn't necessarily fit within a Mediterranean style eating pattern. So it's another example of why nutrition is never a one size fits all. And another point actually I'd like to make is that taking anti-inflammatory supplements don't make any sense to me at all if everything else isn't dialed in. I'll often see, whether it's on social media or in clinic, people thinking that if they just take an anti-inflammatory supplement, that they can eat whatever they want, and it just doesn't work like that. So it's just not one supplement, food, or green powder that creates health. It's the overall pattern, combined with lifestyle factors such as exercise, sleep, stress management, non-smoking, and drinking alcohol that has the greatest impact on long-term health overall. So I really encourage you to think about building meals around the the foods here, that are recommended in a Mediterranean diet, such as fruit, vegetables, whole grains, high quality protein, and healthy fats. These foods naturally provide fiber, vitamins, minerals, antioxidants, and other plant compounds that work together to support overall health, which is much more than what any supplement can provide. So, I've popped in a slide about ketogenic diets and fasting because patients frequently ask me about whether ketogenic diets are useful. There are some randomized clinical trials that test specific dietary interventions, but there aren't many that test them during cancer treatment. So the nutritional needs of patients going through treatment vary based on the treatment regimen, nutritional status of the patient, and any other comorbidities. And diets such as ketogenic and fasting potentially limit nutrients that influence how someone will tolerate treatment. So I'm reluctant to prescribe it. There's some ongoing trials, but there isn't yet any safety data that I've been able to find regarding the implementation of keto diets or fasting in these patients. So it's definitely a space to watch as new research emerges, which I think it will in the coming years. But yeah, not yet. Fasting refers to the voluntary abstention from food for specific periods. So you can have intermittent fasting, which restricts food to eating within specific hours, such as, like 8 hours of a day, like between 8 a.m. and 4 p.m. or something like that. Or you've got prolonged fasting, which is days of fasting. And both of these alter metabolic pathways and cellular processes that promote health and reduce the risk of chronic diseases. But there just isn't enough evidence yet that they're safe during treatment. I have seen some good results in clinic in clients who are survivors, who are trialing intermittent fasting, where they're only eating within, say, an 8 to 10 hour window. But I haven't actually seen anything in any client who is undergoing treatment. So, yeah, definitely a space to watch. So the priorities during treatment really are quite different for priorities for long-term disease prevention, such as Mediterranean diet. So it doesn't really matter, like what the treatment is, whatever it is, the goal isn't to really achieve a perfect diet. It's really just to support the body through the treatment. So it means focusing on eating enough. Cancer and treatments can make eating incredibly difficult. Um, so when it becomes difficult, it's really common for people to unintentionally not eat enough. And if this continues over time, then it increases the risk of malnutrition. So sometimes the healthiest thing to eat isn't a salad, it's the bowl of soup, it's a smoothie, it's a yogurt, it could even be a custard because it's all the things that someone might be able to just tolerate that particular day. So I just think, well, I often tell my patients that the food you can eat is better than the perfect food you can't eat. So I just think that takes the pressure off. And when you're feeling well enough, then we get back to the Mediterranean style of eating. The second one is maintaining muscle and function. So sometimes, or actually often when people are thinking about nutrition, they think about the number on the scales, but I'm much more interested in muscle mass. Muscle's essential for strength, mobility, recovery, immune function, and maintaining independence. But it's also associated with better treatment tolerance and recovery after surgery, as well as quality of life. So that's why adequate protein intake, wherever possible, and gentle physical activity or resistance exercise are really important if you can manage it. The goal isn't just to maintain the number on the scales, it's really about strength and function. The third one is managing treatment symptoms. Um, there isn't a perfect diet that works for everyone because everyone experiences treatment differently, as I've said before. So, someone with severe diarrhea will need different strategies to someone with constipation, etc. So, recommendations need to adapt to the symptoms that a person's experiencing. And those recommendations may even change throughout treatment depending on the side effects. And then finally, there's the final priority is avoiding unnecessary dietary restrictions. And that's, yeah, one of the saddest things I see when people stop eating fruit because it includes sugar, or they avoid soy because of outdated information. Um, and the result is often a diet that's unnecessarily restrictive and it doesn't meet nutritional requirements. And it's also incredibly stressful. So unless there's a specific medical reason, such as celiac disease, an allergy, or advice from your oncology team, most people don't benefit from eliminating whole food groups during cancer treatment. So I really think food should be a source of nourishment, not fear. Okay, now protein, I've banged on about protein quite a bit. It's one of the nutrients we pay the closest attention to during treatment. It's essential for muscle mass, supporting wound healing after surgery, and helping the immune system function. It's also important for maintaining strength and physical function. So it's for these reasons that protein requirements are often higher during treatment than they are for the general population. And the European Society for Clinical Nutrition and Metabolism recommends protein intake of 1.5 grams per kilo of body weight per day for people with cancer. So to put that into perspective, if someone's weighing 70 kilos, they would need around 105 grams of protein each day. These are general recommendations. It's not an individual prescription. People with kidney disease, liver disease, or other complex conditions should always have their requirements assessed individually. Another important point is that protein works best when it's spread across the day. There's no point having like 100 grams of protein in one meal because it just can't be processed that way. It really needs to be spread out, across all main meals. So I really encourage you to include a quality source of protein at each meal. And if you have snacks, it's great to include protein sources then too. So great protein sources are things like eggs, dairy, fish, chicken and lean meats, soy products like tofu, tempeh, soy milk, legumes, nuts, and nut butters. And if someone's struggling to meet their requirements because of poor appetite or treatment side effects, then protein-enriched smoothies, soups, and some oral nutrition supplements can help. But I'd like to emphasize that protein alone isn't enough. The body needs enough total energy or calories to use the protein for maintaining muscle and repairing tissue. Because if you're not eating enough overall, the body might start using that protein as a source of energy instead of using it for healing. So, hydration's the other important aspect of nutrition. Our bodies really rely on adequate fluid just to circulate nutrients, regulate body temperatures, support kidney and liver function, and maintain blood pressure and digestion. Um, it can become more challenging though when you're going through treatment. So I like to aim for about 2 liters a day, but fluid requirements depend on, your size, how hot it is, whatever treatment you're going through, what medications you're on, whether there's diarrhea or vomiting or anything like that. So yeah, rather than fixating on a target, I just like to recommend regular fluid intake throughout the day. Um, And water's not the only source. It's excellent. But other sources include milk, soups, herbal teas, electrolytes, and smoothies. Electrolytes are really helpful, especially if somebody is experiencing persistent vomiting or diarrhea, because they replace the electrolytes that are lost. Um, and also, I'd just like you to recognize some of the common signs of dehydration, which might include feeling unusually thirsty, having a dry mouth, dark yellow urine, going to the toilet less often. If you start feeling dizzy when standing up, having headaches or fatigue, then these can all be signs of dehydration. So it's a good idea to have a glass of water. Okay, so one of the biggest challenges during cancer treatment isn't knowing what to eat, but it's actually being able to eat. And as I've mentioned before, cancer treatment affects pretty much every aspect of eating and drinking, and everybody experiences it differently. Um, Along with that, fatigue can actually make shopping for food and cooking and preparing meals just that much more difficult. So these side effects on the slide, they're not the only ones, but I just thought I'd pop them up. There's a few ideas about how we can address different things like taste changes, nausea, and mouth sores. Um, so yeah, so there's lots of practical strategies that we can help, and the earlier we get on top of some of these symptoms, the easier they are to manage. I've often been asked another question about drinking coffee or having caffeine. Usually, like for most people, the issue, it's not even an issue. There's no evidence that drinking moderate amounts of coffee or caffeine reduces the effectiveness of treatment. So if you enjoy coffee, there's no reason to stop drinking it. But there's some situations where you might want to adjust your intake. If treatment's causing nausea, reflux, diarrhea, or mouth ulcers, coffee might make these symptoms feel worse. Some people also find that their taste changes during treatment and they suddenly don't like to drink coffee or even eat foods that they used to like. Sometimes the caffeine can affect sleep as well, where it might not have before. So it's really just something to monitor and see how you feel. If you feel fine, continue to enjoy it in moderation. But if it doesn't make you feel good, then it might be worth temporarily pausing it. So yeah, if your eating in general is becoming difficult, or if you're unintentionally losing weight, or if you're feeling like it's preventing you from meeting your nutritional needs, it's important to seek support early and working with a qualified clinical nutritionist or dietitian alongside your oncology team to help develop an individualized plan that supports both your nutritional status, but also supporting your quality of life is really important. Okay. Foods that support recovery. Recovery is supported by consistently eating a balanced and nourishing diet, which is basically, I've covered this before. Your body's working really hard to recover. So, it might be repairing tissues after surgery or chemo or radiotherapy or rebuilding muscle that's lost and gradually restoring strength. So, all of those processes require adequate nutrition. Um, I've already mentioned protein, really important. Alongside protein, also the variety of colorful fruits and vegetables, which provide all of the vitamins and minerals that you need for recovery. So basically looking at eating a rainbow of colors across the week. I often mention to clients about eating 30 plus plant foods, which does have eyes opening wide, but it's actually not as hard as it sounds if you think about fruits, vegetables, grains, herbs, spices. Any plant food is part of that. So it really isn't as hard as it sounds to sort of get that diversity of plant foods. And yeah, I've mentioned hydration. So basically, I guess the point is consistency matters way more than perfection. Some days your appetite will be better than others, and that's completely normal. So um, I think that's about all I need to say about that one. Now, oral nutrition supplements, I wasn't going to include this, but I did have a question about it, and I thought it was a really good opportunity just to show the options here. So, in hospital, I know that it's often recommended for patients to consume Ensure or Sustagen. And I know that they can be quite easy, but I just wanted to show these. Like Ensure only has 9 grams of protein per serve. The calories are negligible. It's only 150 odd calories. And while it includes a lot of vitamins and minerals, they're poorly absorbed forms. And Ensure includes emulsifiers, sugar, vegetable oil, sweeteners that are linked to tumors, leukemia, and chronic respiratory disease in animal studies, and stabilizers that may cause gastrointestinal cancers and may be linked to irritable bowel disease. This information you can find. I use an app called Chemical Maze, and you can look up any um, additive number in this app, and it will tell you how safe it is based on research. Um, so yeah, so I would avoid Ensure as much as possible. Sustagen is another hospital formula. It has a little bit more protein. It's unclear about the forms of vitamins and minerals. I couldn't find any information on the internet about whether they're absorbable or not. Um, it's sweetened with corn syrup, solids, and sugar. It's unknown where the flavoring or what sort of flavoring they use. It is gluten-free, but again, really not good enough. Um, Now, the Lady Shake is, it made me quiver actually putting this in because I really don't like it. But I actually only put it in because I've been asked for lactose-free options. So this is only recommended by me if you're needing a lactose-free option. It includes 30 grams of protein. It does include less vitamins and minerals, but they're still decent ones. It uses natural sweeteners and it's lactose and gluten-free. But the king of all meal replacements that I could find is from True Protein. It's got a decent amount of calories and protein. They're really high quality forms of vitamins and minerals. They only use natural sweeteners, no artificial additives, and it's gluten free. So I'm a big fan of True protein powders. I'm not paid to say that. I actually personally use this brand and love it. Um, so it can be ordered online from True Protein, and some pharmacies and health food stores stock it. But it's a Sydney-based company, and I highly recommend it above Ensure and Sustagen. So hopefully that has helped address that. But having said that, whole foods and meal replacements aren't interchangeable. Whole foods are always best. These oral nutrition supplements are really only recommended for if you can't eat food, and so where they make sense. Okay, I'm almost finished. I want to leave time for questions. Okay, so supplements, it's a big question, and it's one that I get a lot. Many people assume that if a supplement's available over the counter, it must be safe. And when you walk down supermarket and pharmacy aisles, it is just mind-blowing, how many supplements are actually there for anyone to just grab and take. But they're not always safe. They're biologically active and they can affect how the body functions, how medications are absorbed and metabolized, and sometimes they can affect how cancer treatment works. So it's one of the reasons why it's really important to let your oncology team know about everything that you're taking, not just prescription meds, but also vitamins, minerals, any herbs, powders, herbal teas, and any complementary medicines. Um, One of the principles I generally follow, not just in oncology, but anyway, just with anyone, is food first where possible. Whole foods provide much more than individual vitamins or minerals. They contain fiber, protein, hundreds of naturally occurring compounds that work together in ways that supplements just can't replace. But supplements are a great tool where we need them. There are certainly situations where they're appropriate and sometimes when they're essential. If someone's got a diagnosed vitamin or mineral deficiency, or if there's poor dietary intake for an extended period, if there's gut malabsorption with diarrhea or following surgery, um, if there's increased nutritional requirements during treatment, or if there's challenges with meeting needs through food alone. So in these situations, supplements should be used to correct a specific need rather than just being taken just in case. And another area I'd encourage caution is with high dose supplements. More isn't always better. And sometimes very large doses of certain vitamins and minerals or antioxidants can interfere with some cancer treatment. So, yeah, we need to remember that many herbal products haven't been well studied alongside chemotherapy or immunotherapy or targeted therapies, which is really unfortunate because I know that there's a lot of research on these compounds otherwise. It's just that they haven't been tested or trialed during cancer treatment. So it's just not clear how it works. Um, so, yeah, it doesn't necessarily mean that they're harmful. We just don't have enough evidence. And there's no universal supplement that I recommend for every client with cancer. It just really depends on the person's individual status, what their treatment regime is, what their pathology results say, what their medical history is, what medications they're on, what they're eating. And that's why everything's individualized. So if you're starting a supplement, I encourage yourself to ask these three questions. Is there good quality human evidence that it might help? Is it appropriate for my situation and the treatment that I'm undertaking? And has it been reviewed by my treating team for safety and potential interactions? And if you can answer these questions and feel comfortable, and the treating team feels comfortable, well, then everything should be pretty cool. So that is, we're coming to the end. I've got a range of references which will be included in the slides that I will send you after this. And I would just like to say thank you so much for spending all this time with me. I hope I haven't gone through this too fast. I had so much information that I wanted to cover, and I probably could have made this 2 hours long, and it still wouldn't have been enough time. So I'll just stop recording and